guys, you're watching HealthSite and this is Mini Divan. Today we are going to talk about hair therapies. And for that, we have with us in house today Dr. Debraj Shome, Senior Cosmetic Surgeon, Director of Aesthetic Clinic, super specialized in facial plastic surgeries and of course cosmetic surgeries and hair transplants as well. So welcome to our channel, Debraj. Let's talk about, hair therapies, hair transplants, what are the different procedures. Could you elaborate a bit on, because I'm sure there are different procedures that exist in the market, and also we are going to come on the procedure that you specialize in and that you guys discovered. So we'll quickly move to that as well. But what are the different basic procedures when it comes to hair transplants?
So hair is a continuously ongoing process, right? I mean, hair fall is increasing and getting augmented, and people are losing hair all the time. So today, if you look at the data which is available, the data is that almost 50% plus people over the age of 35 in men, and almost 30% women over the age of 35 are losing hair. In fact, we see patients now presenting to us with hair fall even in the early second decade of life, by 22, 23. So genetic reasons, hormonal reasons are leading to more and more people losing hair.
Yeah.
Because if someone lost hair, especially a woman, the fact that they would look older, especially in cancers, etc., when they lose hair post the chemotherapy, it can impact their quality of life much more than even the chemo, because they look at themselves in the mirror, they see they have no hair, and that in turn causes so much self-pity that ultimately, it's even worse than living with the cancer. So from that perspective, I think hair is a massive issue today's day and age. And today the ability is there to non-surgically grow hair.
That's true. Actually, I was about to come to this only about QR678 and how does it work? How is it different from any other hair transplant? And I think because there are other non-surgical therapies as well.
10 years earlier, purely by serendipity, in my earlier avatar as a surgeon at the Tata Memorial Hospital and also working with the IIT scientists, we actually managed to formulate a hair solution, and that hair solution, we called it the QR678. You can actually see it behind my head also in the background. And the QR678 is a combination of 6 growth factors, which comes out of a vial and causes hair growth. More than 21,000 patients all over the world have been treated with it. It has a US patent, it has an Indian patent. It is now being exported from India to 10 plus countries. The process is very simple. Growth factors have to be administered to the scalp. It takes about 20 seconds to do the procedure in the doctor's clinic, and it can cause some wonderful results. So because of the QR678, especially doctors like us, doctors like me, as well as others, the rates of hair transplant have come down. When surgery is not required, then why should we unnecessarily do surgery?
So how many sittings does it take for this procedure to get done?
Depends on, so it could be, the answer could be very different for different people, Mini. For you, suppose you wanted a little bit thicker hair, then possibly even 2 sessions would do it. But for someone who's lost about 60% of their scalp hair, maybe 6 to 8 sessions may be required. Each session is done at every 3 weekly intervals. So somewhere between 6 to 8 sessions is the average for people who have significant hair fall.
And this will last for 10 years longer?
It depends, It depends. It depends on what caused the hair fall. Suppose it was due to certain problems like post-COVID, people are losing hair. So telogen effluvium post-COVID is a very common problem, and the QR678 has been shown to have great effects in telogen effluvium post-COVID. All of these things that I'm talking about, all of the papers of the QR678 are all published in top American journals. There are 10 plus research papers published. So if telogen effluvium has been caused by COVID and it causes hair fall, then in that case, once you've taken the QR, you may never need it again if you don't get COVID. But suppose you are losing hair due to a hormonal cause, and the hormonal cause has not been changed, it's still there in the body, then yes, the QR would cause the hair growth back, but the hormones may cause the hair to fall off again in a couple of years, and you may need a few repeat injections, or you may need some re-administration as well.
That's very actually well put, and that's so true. But if we talk about certain things that one should keep in mind when patients are coming in for their hair transplant requirements or demands, is there anything that they should keep in mind while getting their procedures done?
Now you have to understand that the doctor is also a human being like you. If you come when you've started losing hair, it's easier to treat you. But if you come in when you've lost all the hair on your head and suddenly one morning you wake up and say, "Ab mujhe baal chahiye, now I need hair on my head," it might not be so easy, to do. So one suggestion to patients is, please make up your mind. Either you want hair or you don't want hair. If the answer is I want hair, why not treat it when you start losing hair rather than wait for 10 years, by which time you've lost 90% of your hair and then expect the doctor to do miracles. So that I think is the primary thing that I would like to talk about.
That's true. I think this has been great, Dr. Debraj. And before we end this, anything else that you would want to suggest our users to keep in mind for longevity and healthy skin and a healthy lifestyle?
I divide the world into the Facebook generation and the Instagram generation. And my take-home message for the Instagram generation would be: start early. Start before you hit 25. If you start your facial treatments and you start your skin treatment before you turn 25, believe me, at age 75, you'll still look like Sophia Loren. You'll still look like you're 25 years old. So start early. That's point number one. Point number two is avoid dissonance. What I mean by avoiding dissonance is, people want to have great skin. Then they want to go and eat on the road and eat the pav bhaji on the road. And then they come to a doctor and say, "I've got acne. Does the medicine that you're giving me have side effects?" It makes me laugh, because they are not thinking about the side effects of what they are putting, the food that they are eating, the water that they are drinking, the air that they are taking in. They are not bothered about the side effects of those, and they are thinking the 20 minutes consultation with the doctor should negate all the changes which have occurred in their body because of their bad habits. So as a result of which, avoid dissonance. If you want great skin, spend time on it. Make sure that people are able to, you're able to exercise, you're able to take good air, you're able to eat healthy food, and only then go to a doctor to take care of things.
Thank you so much, Dr. Debraj. I think this has been so informative. We have had some wonderful insights from you today, and I think our audience would be going back home after listening to this session with lots and lots of wonderful information and value addition. So thank you for that.
Thank you, Minnie. Thank you for speaking to me today. And thank you for being such a pleasant host and making me feel so welcome. And thank you to the entire HealthSite team and to Z. Love you all. Stay safe and take care of yourself. Bye.
Thank you so much. Stay safe and take care. Thank you.
Bye.